start the recording. Okay. So here, sulfonamides are the antibiotics, the drugs which is used to it's acting on dihydrofolate synthesis enzyme by which it will inhibit the synthesis of the DNA. Okay, it stops the synthesis of dihydroprotic acid and then dihydrofolic acid, which was very, very much important for the synthesis of nucleotide, for the synthesis of DNA. What happens if the synthesis of DNA is inhibited, is stopped? In that case, the drugs are inhibited. The multiplication of the multiplication of the bacterial will be inhibited and the drug will shows the effect. The amount of bacteria in the body will get reduced continuously, and that may causes decrease number of bacteria and the infection. And another, like here, the Cotrimoxazole and fluoroquinolones. When we talk about fluoroquinolones, it is acting on topoisomerase 2 and 4 type of enzymes. And here, this is basically acting, stopping the DNA coiling, and then that may affect the drug, that may show the functioning of the bacteria, and the cell wall get damaged. Not cell wall get damaged, the multiplication will be inhibited. So here, the first drug is sulfonamide. Okay, can everybody hear me properly? The first drug is sulfonamide. What is sulfonamide? Can everybody hear me properly? Can you say yes or no, please? Okay, thank you. So here, the sulfonamides were the first antimicrobial agents that affect against pyogenic bacterial infection. What are these? Active against the first. What do you mean by pyogenic? Those bacteria, those conditions, those bacteria that produces fever, like gram-positive have a cell and the gram-negative bacteria. And this sulfonamide, they are primarily bacteriostatic against gram-positive and gram-negative bacteria. So we'll see here what is the difference between gram-positive and gram-negative bacteria. When we talk about gram-positive bacteria, the gram-positive bacteria has a cell wall which is thick and which is peptide glycan layer outside the cell membrane, and that is called cell wall. But whereas in the gram-negative bacteria, the cell wall is made up of polydoglycan, which is sandwiched between the member of bacterial outer membrane. So here, this is about the pyogenic bacteria. So what do you mean by pyogenic? It is something which causes fever. The next is, they are primarily bacteriostatic. What do you mean by bacteriostatic? So it stops the multiplication of bacteria, and again they are active against both gram-positive as well as gram-negative bacteria. Their current utility is limited because of why? Because of bacterial resistance, but they are used in combination with trimethoprim, as the drug is cotrimoxazole or pyrimethine, for in the case of conditions like malaria. So here, when we are giving sulfonamide, the normal form, a single drug, then because of the fast upcoming resistance, the bacteria can produce resistance to that particular drug very quickly. So because of that, when it is given in the form of combination with trimethoprim or maybe pyrimethamine. This sulfonamide is classified under 3 different classes: short-acting drugs, long-acting drugs, and the intermediate-acting drugs. How do we classify between short, intermediate, and the long acting? The drugs which is acting, say suppose here 4 to 8 hours, so that is something short acting drug. So this drug has to be given to the patient at least 3 to 4 times a day, from 3 to 4 times a day, TID or maybe QD. And intermediate acting drugs, here these drugs which is acting 8 to 12 hours. So here it is 8 to 12 hours, that means it can be given 3 to 2 times a day, twice a day. That means TID or maybe BD, based upon, and the long acting drug that is long, that is for more than a week. So here, what do you mean by that? Here it based upon the effect of a drug on the body and acting against the bacterial infection for a time duration based upon the half-life. These drugs are classified as short-acting, intermediate acting, and the long-acting drugs. And the short-acting drugs like sulfoxazole and sulfacytine and sulfamethoxazole. Intermediate-acting drugs like sulfadiazine and sulfamethoxazole, and long-acting drug is sulfadoxine and sulfamethoxypyrazine. So these are the drugs which is used in short, intermediate, and long-acting form of a drugs. What is the mechanism? What is the basic mechanism? It inhibits the enzyme folic acid synthesis. It inhibits the enzyme folic acid synthesis, which is involved in formation of folic acid, which is involved in the formation of folic acid. So here, it causes folic acid deficiency and ultimately causes injury to the bacterial cell. And sulfonamides widely distributed themselves in the body. They can enter the CSF and they can cross placental barrier, the cerebrospinal fluid, and they can also cross the placental barrier. So here, what is the mechanism? It's inhibit the folic acid synthesis. What happened? What do you mean by this? The basic principle, the basic mechanism. How does this folic acid synthesis takes place? This folic acid synthesis will be took place when dihydrofolate diphosphate is combined with PABA, para-amino butyric acid, when it's combined with PABA, PABA, in the presence of dihydrofolate synthesis. So here it is where it is acting. It binds to the, in the presence of dihydrofolate enzyme, synthetic enzyme, it will convert it to dihydropetric acid, and that will be formed dihydrofolic acid. And in the formation and dihydrofolate reductase, this drug may lead to folic acid, and that folic acid is responsible for the development of the bacterial cell and for the formation of DNA or the nucleotides. Okay, so here when we are stopping the initial process, the formation of folic acid by inhibiting the dihydrofolate synthesis, then that is decreasing the amount of we are inhibiting the development in the bacterial cell, and that will decreases the bacterial formation replication DNA, and that will cause decreased number of bacterial in the body. And here there is one more thing is that important to be seen, that this can cause the CSF, and this can also causes the placenta. Sulfoxazole and sulfamethoxazole, these are the most common drug which is given to the patient if the patient is suffering with urinary tract infection. Okay, and this can be suppose E. coli or maybe some other bacteria where the infection and the patient starts having a feeling of burning sensation and the other stuff, difficulty in the urination. So in that case, urinary tract infection, these drugs are given. Respiratory tract infection, the patient has problem with the respiratory tract. Sinusitis, so here in the case of sinus, when there is a blockage of the nasal cavity and the patient has difficulty in the breathing and heavy head. and bronchitis, and in the case of pneumonia. So here it is used in the case of upper respiratory tract infection and the lower respiratory tract infection. So what is pneumonia? Pneumonia is a formation of liquid accumulation in the lungs that may causes. So here in this type of condition, this sulfoxazole and sulfamethoxazole type of drugs are being given to the patient to overcome this type of infections. The next thing is the sulfasalazine that is used in the ulcerative colitis and the rheumatoid arthritis condition. Ulcerative colitis, where ulcerative colitis in the ulcers, and in the rheumatoid arthritis, difficulty, joint pain, or the formation of some, what happened in the rheumatoid arthritis, the accumulation of bacteria that may occur in the rheumatic joints, in the, say, suppose knee joint, and the swelling occur and the formation of infection that may also leads that this sulfasalazine is very much effective against that with some anti-inflammatory drugs. And silver sulfadiazine. Silver sulfadiazine, this is a very, very, very good drug, especially in the case of burns. So silver sulfadiazine is given for application topically in the case of burns and topical dressings. And the treatment of meningitis in the patient with severe maxillofollicular trauma. So next is adverse effects. What are the adverse effects? As we know, the most common adverse effects of pharmacology is what it is. It is nausea, vomiting, and other GI disturbance, epigastric pain, rashes, and Stevens-Jones syndrome. What is this Stevens-Jones syndrome? This is the new thing, so you have to be remembering this Stevens-Jones syndromes, other than normal GI disturbance. Stevens-Jones syndrome is a rare condition, a serious disorder of the skin and the mucous membrane, which is often occur in the case where the patient is having often occur in the case where the patient is begin with flu symptoms followed by painful red or purplish rashes that spread and blister, and then the top layer is affected and the skin dies, sheds, and heals, often reported easily for a long-acting sulfonamide. So here is in the case of long-acting sulfonamides, this type of condition has been more commonly seen. What and it is a serious disorder of the skin, and here especially, and the mucous membrane is like affected. And the usual reaction of this medication and or the infection is starts with the flu and followed by the painful purplish conditions. So here it is something, a condition that may be a Stevens-Jones syndrome. So here as seen in the figure, it shows that like here the blister type thing which will be developed, and that will be a little bit painful condition. Next, resistance. How does they are getting resistance? The resistance is most bacteria are capable of developing resistance, like maximum all the bacteria is capable of producing resistance, what we have seen. But here in the case of this sulfonamides, when the organism is resistant, one sulfonamide, it is resistant to all of the sulfonamides. So here, this is the point. So if if the bacteria is resistant to any one of these sulfonamides, so suppose example, any one of these sulfonamide, and that shows that the bacteria will be resistant to all the sulfonamides. And it developed, the resistance has a limited and the clinical usefulness. So here once the resistance is developed, then later on the clinical limitations will be occurred. Next drug is trimethoprim. What is trimethoprim? It is a fixed dose combination of trimethoprim and sulfamethoxazole is given in, so the, okay, we'll see this sentence later on. What is trimethoprim? Trimethoprim is basically a drug that is inhibiting, that's block the DNA synthesis by bacterial dihydrofolate reductase enzyme. And then because it is causing a difficulty, the similar action, dihydrofolate reductase enzyme, and that is inhibiting the formation of DNA. What it is drug? It is a bacteriostatic type of drug, like similar as that of sulfonamide. And here it is used in a fixed combination of sulfamethoxazole with trimethoprim. Sulfamethoxazole and trimethoprim is used in fixed combination, 200 milligram plus 500 milligram, something like that. Okay, and here the useful in the treatment of basic and acute urinary tract infection. In the case of acute urinary tract infection, a person has got an acute urinary tract infection. In that case, it is very much useful drug and effective very quickly. In some cases, if an infection is a minor, okay, the less than only trimethoprim 200 or 400 milligram will be given, or based upon the severity, a combination of the drug is preferred. And here, what is the benefit of giving combination drug? The effect will be much more higher and beneficial with less possibility of getting resistance. What we have faced problem with the sulfonamides. Adverse effect. What is the adverse effects? The adverse effect of the drug over here is a megaloblastic anemia, where the RBCs will become large, leukopenia, and this can be prevented by stimulus administration of folic acid. So what are these adverse effects is caused by this condition, this drug? The adverse effect is caused because of decreased folic acid in the body. Why decreased folic acid? Because these drugs are inhibiting the synthesis of folic acid. So that causes decreased folic acid in the cell and in the body, and because of that, that may lead to anemic condition to the patient. What is leukopenia? It is a number of white blood cells. Decrease in number of white blood cells will be also seen. So this is a problem issue. So then what happens when the number of white blood cells, WBCs, are decreased in the body? The patients are like more likely to or more prone to get infection when compared to the other patients, other persons. Okay. The next is cotrimoxazole. A combination of trimethoprim given together with sulfamethoxazole result in marked enhancement of the activity. So here these drugs, when they combine with each other, trimethoprim and sulfamethoxazole, here when on addition, the activity has been increased by each other. So here what we have seen a potentiation or the synergism of drugs. So here what it is, one drug in combination with another is increases a supportive action and showing the increase in activity. So here what we have seen, this trimethoprim and sulfamethoxazole, they both are bacteriostatic type of a drug, and when on combination with these two, what it will do, it is affecting DNA synthesis by folic acid synthesis and dihydrofolate reductase synthesis. So what happened? In two different mechanisms, these drugs are acting on the bacterial cell, and that is making this drug more powerful. And this individual, both sulfonamide and trimethoprim, are bacteriostatic, but when on combination, this will become bactericidal. So here, why it is becoming bactericidal? Now there might be a question arises in your mind. Why it is becoming bactericidal? Because of the potentiation effect. The effect of the drug is increased when it is given in combination. They are like, suppose example, when we see, I will give you a very common example here. Okay, like when somebody, a patient comes to you and you say, for a pain, so suppose headache or maybe something, and then what you will advise? You advise him a Panadol. and the patient says to you that, okay, I will take Panadol, but I need some medication that should act much faster than compared to this Panadol. So what you will do? You will prescribe him Panadol extra, or you will ask the patient to take Panadol, paracetamol tablet with a coffee or tea. Why? Because the effect of this particular drug, paracetamol, can be increased in the presence of caffeine. It will work much more faster. So that's why it's written Panadol extra, a combination of paracetamol or caffeine, or else a paracetamol normal tablet with a teacup of tea or coffee. Okay, strong coffee, say example with cup of coffee. So what it will do, it will give a synergism effect, an increased effect. So the similar way here, these two bacteriostatic drugs are making increasing the effect of each other and makes become bactericide. And the useful of what is used in the treatment, what type of treatment? It can be used in the combination treatment of tonsillitis, pharyngitis, okay, and sinusitis and chronic bronchitis. So in the case of infection in the from ENT infections, say example, in those cases, this combination is very much useful. Ear, nose, and tongue. So here not in the case of tongue, say example, ear and nose, sorry, nose and throat, tonsils and nose, sinusitis and upper respiratory tract infection. And in the case of UTI, both acute as well as recurrent condition, in both the cases, this is very good. Like acute and the recurrent means the patient is getting infected very easily. So generally, this will happen maybe hospital-acquired immune deficiency in their hospital-acquired infection, or maybe some exposure to that particular type of bacteria continuous. So that causes recurrence of the one infection. So in that case, this combination, cotrimoxazole, a combination of trimethoprim and sulfomethoxazole, is very much good. The next is in many cases, the bacterial diarrhea and dysentery respond well to cotrimoxazole in the case of what is bacterial diarrhea. How do we know the patient is suffering with the normal diarrhea or the bacterial diarrhea? Like we might have seen a patient after taking paracetamol, a patient got diarrhea. How do we know? So here, in one case, like what is if the diarrhea we're talking about diarrhea, normal diarrhea, how we differentiate? The normal diarrhea is the patient when it's have a normal diarrhea, the amount of fluid will be excess moves out. Okay, diarrhea means loose motions. Okay, excess fluid loss, and if the patient taking the medication to stop the diarrhea, in that case, that medication is not able to stop the diarrhea, like say suppose loperamide or morphine sulfate or maybe something else, the drugs that stops the diarrhea, or maybe electrolyte, ORS, etc., etc. If these drugs are not able to stop and the diarrhea is continuous for more than 2 or 3 days, in that case, it is necessary to check, is it because of some infection or some bacterial infection. So in that case, if the bacteria will be the diarrhea will be there for more than 2 days or more than 48 hours and it's continuous, then in that case, in the case of that may be a bacterial diarrhea. And based upon that, a broad spectrum drug, one of them drug is like a combination of this drug can be given to the patient to overcome that condition. Resistance of this combination drug is very, very less. It's like when compared to when we are giving single dose. Combination has been slow to develop compared to the either dose alone. So when we are giving a single drug like trimethoprim or sulfomethoxazole or sulfodiazine, anything, the resistance will develop very slowly over here. And the problem over here is the patient might have normal GI disturbance, adverse effect like nausea, vomiting, stomatitis, and rashes. And contraindication is this drug cannot be given during the pregnancy. Why? Because we have seen over here the sulfomethoxazole, the drug, which is what we have seen previously in one slide where it was here. We have seen that in this case, in slide number 4, it crosses the placental barrier. So what it means, it crosses the placental barrier and it can be dangerous to the fetus. Okay, the next is quinolones. What are these quinolones? Quinolones are the drugs which are synthetic antimicrobial agent effective against gram-negative bacteria. Quinolones, fluoroquinolones, etc., etc. The second generation of quinolones are fluoroquinolones, and they are effective against both type of bacteria. It can be gram-positive or gram-negative. But here the synthetic, the effective one, the only quinolones are affecting against more in gram-negative when compared to gram-positive. But here the fluoroquinolones, they are active against both positive as well as the negative form of bacteria. The mechanism is, it is binding, these fluoroquinolones are binding, the block the bacterial DNA synthesis by inhibiting the enzyme. Here, bacterial topoisomerase 2 and DNA guidase, and in gram-negative bacteria, and bacterial topoisomerase 4 in gram-positive bacteria. So here, how it is inhibiting? So we have seen, like maybe you can ask, oh, doctor, you're telling always inhibiting DNA synthesis, DNA synthesis, DNA synthesis. But here, the binding site of these drugs, all these drugs are different. If we have carefully seen, you might get confused. Okay, here what we said, folic acid synthesis, dihydrofolate reductase synthesis. Okay, and in the sulfonamide. And here also I have said, we have said here that it's binding to dihydrofolate reductase enzyme. Okay, and here next is, okay, here one is why this is not moving? Okay, dihydrofolate synthesis and dihydrofolate reductase in two places, two different drugs. And here this is acting on the enzyme that is inhibiting the bacterial topoisomerase 2, that is on DNA guidase, that is in gram-negative bacteria, and topoisomerase 4 in gram-positive bacteria. And fluoroquinolones, these are the drugs which are well tolerated, and these are the drugs which is used by the physicians a lot once a time. Okay, so in some conditions. Mechanism. Resistance is noted so far is due to the reduced permeability and increased efflux that the bacteria crosses the bacterial membrane, the antibiotic, the efflux mechanism or the enzymatic activation, the etc., how they are forming resistance. So here it is. Yes, somebody said something. No. Okay, maybe echo. So here, what I was telling, okay, this is because of increased efflux mechanism. This bacteria can, sorry, this antibiotic can produce resistance in the bacterial membrane. And this fluoroquinolones is, as we know, it is acting by an enzyme, okay, inhibiting the enzyme which is in bacterial topoisomerase 2 and bacterial topoisomerase 4. Adverse effect is like normal GIT disturbance, like nausea, vomiting, diarrhea, headache, insomnia, skin rashes, and occasionally abnormal liver tests and fluorophloxacin. Problems are contraindicated in the case of pregnancy. This cannot be given in the case of pregnancy. The drugs are like which are coming. What happened? Please switch off the speakers, please. Okay, so here what I was talking, the drugs like ciprofloxacin, norfloxacin, ofloxacin, and levofloxacin. So here, ciprofloxacin is available in 250 to 500 milligrams, and levofloxacin 200 and 400, and oflox, and like any other drugs. So any GIT, diarrhea, those type of conditions, UTI, okay, typhoid fever, a combination, septicemia, etc., etc. So here, what are the therapeutic uses where these drugs are used? These drugs are used in urinary tract infection, bacterial and bacterial gastritis in the case of GIT disorder, gastroenteritis, and typhoid fever in the case of typhoid fever caused by typhus, and septicemia. What is septicemia? Septicemia is a condition where the body will have excess of acid or poison production could be because of some injury or some infection which is increased inside the body. Otitis media means it is infection in the ears, and that could be an inflamed infection which is very painful condition. And ocular infection in the eyes. Okay, so in the case of eye otitis and the eye or other infection, eye infection, then the eye drops and the ear drops are ciprofloxacin ear drops or the eye drops are being given to the patients to overcome this type of condition, this type of infection. Okay, so here in this to the the drug will be in ciprofloxacin and ofloxacin, like eye drops or the ear drops are available, and then rest all this condition, the tablet or the IV liquid will be given to the patients. Next, ciprofloxacin is more potent first generation fluoroquinolones, showing a bactericidal activity. So it is killing the bacteria. So it kills the bacteria. So that's why it's bactericidal activity, and it should be taken with or before food. Why? Because food delays the absorption, means the effect may be a little bit slow. And because it is wide spectrum, bactericidal activity in oral efficacy is good tolerable to the patient, and it is used in a blind therapy infection, but should not be used in the case of minor cases. So in minor infection, this should not be used. Like, say, suppose example, if we have a doubt, a patient is suffering with a diarrhea, and the patient is having a diarrhea like infectious diarrhea, and those one of those type of conditions, maybe we can try this. And ciprofloxacin, levofloxacin is more commonly given in the case of throat, eye, in other infections, which is say suppose eyes, neck, ear type of condition. And ciprofloxacin may be combined with metronidazole for some cases and the refractive mixed infection in periodontitis. So in the case of periodontitis, it is combined with metronidazole. Metronidazole, the dose will be here 500 milligrams will be given almost up to 3 times a day. 500 milligram, that is TID for dentistry, and this can be given from up to 3 to 7 days, or 3, 5, or 7 days, based upon the severity of the infection. The days can be like more or maybe less. Okay. Anything else do I have to check? Let me check. Okay. Here, any questions, any doubt, anything you want to ask, please. Any questions, please? Any doubt? Okay. Thank you very much. Have a nice day.